Okay, good morning, good afternoon, good evening, everybody. This is Elham Yusufian, the Inclusive Humanitarian Action and Disaster Risk Reduction from the International Disability Alliance Secretariat. Welcome to the launch event for the report by stakeholders group of persons with disabilities in sustainable development on the experience of people with disabilities with COVID-19. We are very delighted to have you join us today, and we hope that during the next hour, we are going to hear from some of those who have been engaged in preparing this report, as well as some of persons with disabilities from all over the world who will give us testimonies about their experiences with COVID-19. So regarding this report, as soon as the COVID-19 break out, we realized that getting information on experience of persons with disabilities with the situation is very critical, and that's how we can show to the international community and convey the message to the world leaders what's happening to persons with disabilities. So there have been many activities to gather information about experiences of persons with disabilities, including gathering quantitative and qualitative data. So we, many organizations took the initiative to collect information, including the stakeholder group of persons with disabilities in sustainable development goals. And during the course of month of May and June, they interviewed 106 people with disabilities from all the regions in collaboration with the members and regional focal points of the stakeholders group and organizations of persons with disabilities, including IDOM members. And they prepared and published this report. I asked my colleague Talin to put the link to the report in the chat box. I think you can see the sign language interpreter on the screen. Some of our speakers are going to have their own sign language interpreters. We are also having live captioning, and we are happy to take questions. So please feel free to type any questions you may have. And also, if you have any technical issues, please feel free to type your requests in the chat box. So in this meeting, we are going to review some of the chapters and findings of this report. The report actually itself has 7 chapters. Chapter 1 on changes in lives of persons with disabilities during COVID. Then in chapter 2, we look at the living conditions of persons with disabilities. In chapter 3, we look at access to healthcare. Chapter 4, social protection. Chapter 5, employment. Chapter 6, violence and crime during the pandemic against persons with disabilities. And chapter 7, data collection. So we are going to review some of these chapters. In each of these small subsessions, we are going to hear a presentation followed by 2 testimonies. So if there's no more questions, we can start. Okay, we can start by inviting Dr. Mohammed Ali Lutfi, the alternative representative of the stakeholders group of persons with disabilities in sustainable development, to brief us about chapter 1 and what changes in lives of persons with disabilities they have documented in this report, including my 2 testimonies that's gonna follow this presentation. Floor is yours.
Thank you, Ilham. Thank you, everyone, for joining us this morning. And it's our great pleasure as the International Disability Alliance and the stakeholder group of persons with disabilities to be launching this very important report during the time of the pandemic with regard to the experiences of persons with disabilities around the world. I'm going to speak about the first chapter, which is sort of an overview, a summary of the other chapters in the report. Um, the report covers a vast, area, or all of the regions in the world, including Africa, Asia, North America and Europe, Latin America, and the Middle East and North Africa. The report discusses a number of areas of experiences, uh, starting first with the overall daily experiences of persons with disabilities, and how persons with disabilities encountered lots of different challenges and different problems that have influenced and or impacted their well-being, their access to food, access to water, access to information, and the protection equipments, personal protection equipments, PPE. And it was very important for us to witness different experiences in different areas, and also with regard to the type of disabilities. You know, the pandemic was a time for a new norm of living, where people started to realize that it's a time for new relationship, or a new connection with family and with different aspects of life. Some people found in this pandemic a time for more contemplative experience and reflection, and have a better time with with family. But in other areas, there have been different kinds of experiences, and I will go through some of them as examples, where reflecting on these experiences based on the type of disability. And we received a lot of experiences that have been shared with us by persons with intellectual disabilities and their families. And for example, in Africa, there have been lots of challenges for persons with intellectual disabilities receiving um, having access to medication and food. In Africa, there are large countries, and in order for some people to have access to food, they have to travel through the country. But because of the lockup, and the governments have exerted restrictions on transportation, so that has been a major challenge for persons with with disabilities, and mainly persons with intellectual disabilities, to have access to food and water, especially that in many countries the stigma against intellectual persons with intellectual disabilities still exist, and lots of people, or like contributors of food, or especially on the government's side, they have deliberately decided not to give food to persons with intellectual disabilities, because they thought that they are not necessarily a priority. And also, with access to water, people had problem having reach to tanks that governments have installed, just because there is a lack of consideration for accessibility issues. These tanks have been installed in a way that either high or low for persons with physical disabilities to access them. A major problem that we have witnessed is access to information, mainly for persons with deaf people and people with hard of hearing, because there haven't been a consideration for sign language interpretation on news, or any mean of circulating information about the instructions on how to cope up with the pandemic. Um, we have seen that mainly in Africa, and in Asia and Latin America. In Europe, there has been a bit of advantage because 7 countries out of 20 European countries have regulations to offer sign language interpretations mainly on national TV stations or national news. So in these countries, deaf people have enjoyed, a chance to uh, have access to information. And also, we have seen a bit of, you know, support by community in Asia, especially in island countries, where having food is not easy because these countries needed to use transportation by water, so they didn't have access to food. Now, I would like to turn to 2 testimonials. I would like to invite our friend from Indonesia, Mr. Taufik Hidayah, to speak, to give his testimony about the experience with pandemic. Thank you. Mr. Taufik, it's up to yours. It's yours.
Thank you for having me. Good day, everyone. I would like to now I would like to testimony about the changes in daily life due to the COVID-19 in the autism community in Indonesia. Right now, we are started to reopen the economy and public facilities. We call it a new normal, even though the COVID case is still quite high at the moment in Indonesia. But the definition itself of the new normal has not yet inclusively for persons with disabilities, especially for persons with autism. In the new normal in Indonesia, in the COVID case, there's still a problem for persons with disabilities, especially for persons with autism, that has a problem with sensory issues to wear PPE like mask, face shield in public facilities, because it's hard to them to wear those because it feels uncomfortable for them in the sensory problem issues. And in public facilities itself, that they have insufficient information for a person with autism to cope with the situation in new normal. Because usually person with autism usually learn coping with the visual. Without that, in the public facilities, they are hard to cope how to do the protocols or health protocols in the facilities. And there are stagnant and regress of child development because the therapy session has been stopped. Even though some healthcare already provide virtual therapy, but the effectiveness of that is still unknown. And in several provinces, the health service start to reopen, but there are still fears among the parents to visit the healthcare facilities because they're overcrowded in public transportation, so the COVID health protocol will not be effective. And this is what happened earlier, several days ago, about a person with autism went missing from their homes because they are stuck in their homes without proper facilities and accommodation in their homes. So they are exploring, and suddenly the family don't know where the child went. So for several days, this child is missing and then after a few days it discovered and reunite with the families. In school settings and education sector, the school is also still closed, even though the Minister of Education already allowed the school in the green zone to reopen with the strict health protocol. But the reasonable education for person with autism is still not yet met because now the virtual education sessions doesn't have the right and doubly effective for person with autism. I think that's all what Indonesia have to say about changes in daily life activities due to the COVID-19 for person with autism community in Indonesia.
Thank you, Mr. Hidayah, for your testimony. Of course, I mean, we can tell, and we have all experienced, and according to the report, there has been lots of experience of anxiety and stress because of the change that the pandemic has imposed on lives of persons with disabilities, especially with regard to people with autism and persons with intellectual disabilities. Now I would like to turn to Mr. Godwin Aro Kappa from Nigeria. He uses a sign language interpreter and his wife is signing for him. Mr. Kappa, floor is yours.
Hello, can you hear me?
Yes, we can.
Okay. Well, yeah, I'm talking about the experience of a person with disability in the COVID-19 pandemic in Cross River State, Nigeria. I wish to thank the stakeholders, group of persons with disability, for the opportunity given to me to talk on my experience and those of deaf persons in Cross River State in Nigeria. During this COVID-19 pandemic, I appreciate this gesture. There is no doubt that the emergency of the COVID-19 pandemic has altered the normal lives of people all over the world. In Nigeria, the pandemic adversely affected deaf persons and disrupted their lives. They could not go about their normal lives as the lockdown kept many of them at home for several weeks. You already know what it feels like to be confined in homes with families, members who cannot sign, and yet no food in the house. The little amount of money majority of them had saved has exhausted in just less than 1 week. Palliatives were not reaching them as there were reports of diversion of relief materials. The palliatives were not, the deaf needed someone they could rally around, and I easily feel that role. Before this pandemic, I worked with the Deaf Association as a technical advisor. But now, I am in the front line of support service to the deaf. I receive various complaints which need urgent action. I was determined to leave no stone unturned in getting their matter to the appropriate authorities. I soon found myself immersed in deaf advocacy during this pandemic period. Prior to the outbreak of the COVID-19 pandemic, I teach special education in the local university. The pandemic closed down schools and government was looking to us, the Academic Staff Union of Universities, to come up with a workable suggestion on engaging students in visual learning. With the neglect of deaf persons in the distribution of palliative quite obvious, I was juggling my time, ruminating with professional colleagues about solving national issues, while also standing up for the rights of deaf persons in Cross River State. Government did not set up any disability response group to cater to the needs of people with disability. As such, disabled persons did not receive special consideration in palliative distribution and cash transfer to vulnerable groups. Even when palliatives are earmarked for disabled persons, there was no mechanism in place to help ascertain if the palliative reached them. Hitherto, no single palliative has reached that person in Cross River State as I speak. I am working with one civil society organization called Green Concern for Development, and as well as with the chairman of the Cross River State Association of the Deaf to ensure that persons get their rightful share of materials and cash support from government and voluntary agencies. They need it more than ever to assuage the pain and burdens of the COVID-19 pandemic. Hopefully, we can achieve success in this with a little more time. Thank you all for your attention.
Thank you, Mr. Kappa, and to your kind wife for this presentation. And I would like to note that Africa has given us lots of, or shared with us lots of experiences about the challenges that deaf people have faced, especially when people are using masks and deaf people cannot interpret what they are saying, or they cannot read lips, and they cannot interpret facial expressions, which is very important for them. And I'd like to also note that Africa has shared with us lots of information about experiences of women with disabilities who have been left behind in terms of receiving food and support during this pandemic. I would like to stop here, and in my capacity as the co-chair of the stakeholder group of persons with disabilities, I would like to thank everybody who have been behind the preparation of this report, Ilham, Ursulia, of course, and Elizabeth, for the great work that you have all done on this excellent report. Thank you very much, and I will turn it over to you, Ilham. Thank you very much.
Thank you so much, Mohammed.
And
for the testimonies. It is always helpful and somehow shocking to hear from persons with disabilities from the ground. And I mean, I have been hearing such stories for the last few months every day, but it's never old. Every time that we hear that, it's new aspects of the story. So without further delay, I want to turn to Elizabeth Lockwood from CBM Global, who has been a very important and key part on drafting and doing the interviews for this report, to walk us very quickly through what the report's finding about access to healthcare. I want to ask both presenters and testimonial providers to please make sure to keep the presentation and testimony right to the time, so that we can make sure that everybody who's been on the schedule can provide their intervention. Elizabeth, thank you so much. I know you have been working a lot on this report, so the best person to give us some brief presentation about what did you find about barriers in accessing healthcare in this report.
Thank you, Ilham. And thank you, Mohammed, before, and everybody I worked with on this report. I'm very glad to be here. In terms of access to healthcare during COVID, we had a set of sections that we used to assess how persons with disabilities were able to access COVID-related care, healthcare, and also regular healthcare services during this pandemic time. We had different issues and barriers emerge from the findings, so we clustered our findings around these three areas: barriers in accessing healthcare facilities and hospitals, 2 barriers in receiving information about COVID, and 3 barriers in accessing medicine. In terms of access to healthcare facilities and hospitals, all regions that we interviewed indicated barriers or limitations for persons with disabilities. Overall, people felt that their life was considered less valuable than those without disabilities. And in some very grave cases, persons with disabilities were denied access to hospitals and sent back home without any support. In many cases, regular healthcare services were suspended or were provided via telemedicine, which also had negative impacts in some cases. Other barriers included lack of disability awareness among staff, which is a general issue, but it was exacerbated. Communication barriers for deaf and hard of hearing, for example, with masks that was already mentioned, and lack of information, and lack of accessible transportation to and from facilities. Also, and I think this will be discussed more in a minute, but support to sign language interpreters or support people were not allowed in healthcare facilities. And this was quite a barrier and very serious in some cases, where people weren't able to communicate what was going on and that they were in pain, which caused a lot of misunderstanding and fear. There was a positive trend in some countries, Pacific Islands and the MENA, Middle East and North African regions, where COVID testing was free and available for persons with disabilities. In terms of access to information related to COVID and healthcare, DPOs played a very strong role in this, because in many cases, governments didn't provide information that was accessible, so DPOs stepped in. And this is really was a recurrent theme that came up in our research. DPOs provided sources of information, raised awareness with members, provided accessible materials in many formats, and in Europe, DPOs took action and assisted refugees with disabilities, providing information because they were being left behind. And many governments did provide sign language interpretation, not consistently, but they provided it. But this was also from deaf associations really advocating for this right and this access. In terms of access to medicine, there were many barriers in countries. Participants expressed difficulty in accessing medicine due to reduced hours in stores. It was difficult to leave home and pick up medicine. There was shortages in medicine or no medicine at all in some cases. For others, there was available medicine, but it was the barrier of getting out of the home, inaccessible transportation, and the very high cost, so no financial means. In some dire cases, COVID-19 triage system excluded the appropriate treatment for persons with disabilities, not on the basis of a medical condition, but discrimination. We also found, and I'll end on this point, there were some good examples highlighted. For example, in Africa, in one country, there was a good practice with collaboration between the ministry focusing on persons with disabilities and DPOs. When the pandemic started, this ministry took action, became responsive, and now there's a solid partnership between this ministry and the DPO representatives. And a very good outcome is that DPO representatives are now part of the Presidential Working Group on COVID. I will go ahead now and introduce our two people giving testimonials. Mark Wheatley from Belgium and Murali Padmanabhan from India. So go ahead, Mark, you now have the floor.
Hello everybody, my name is Mark Wheatley. I'm the chair of the EUED. I'm currently based in Belgium. And I will be providing information about what's been happening here in Europe. There's been lots of barriers that we've seen in place at the moment for deaf people in particular who have relayed their experiences with regard to coronavirus. The first step in that is using the telephone and calling. Not all of the services are currently accessible, and there is no alternative provision. So most of the conversation has been happening across the telephone. This has really been quite problematic. So if people have wanted to go to hospital and they believe they have symptoms of coronavirus, those wearing PPE, personal protective equipment, provide a barrier to those who are deaf and hard of hearing. It leaves individuals unsure about what care they're going to receive and has provided communication difficulties. People have asked for sign language interpreter provision during their stay in hospital or in any other healthcare setting. Interpreter provision has not been allowed because of social distancing measures. VRS systems have been brought into hospitals using iPads and other technologies, but some hospitals don't have equipment to do this, they don't have contracts set up, and it's been quite tricky. People have been stuck. There's been a lack of communication, and this has greatly impacted on those individuals and their families. They're almost at a loss of what to do. Secondly, we've seen with the lockdown, people have had to engage in social distancing. Therefore, people's access to information has been largely restricted. Normally, people would attend certain appointments with sign language interpreters and such like. Without interpreters present, it's created these everyday appointments.
Cattle farmers are
quite
land
difficult.
grabbing in the national park.
We're aware at the moment, we know that this situation has provided a number of barriers, more than what we would normally see. We've really realised that there are extra barriers in place due to the coronavirus pandemic and how people are struggling to access information and access support at present. This problem is not only in Europe, we understand this is the same the world over. People are experiencing similar problems globally. We have to continue to raise the standard and to improve this situation with regard to finding a solution. Thank you.
Thank you so much, Mark. It's wonderful to get your perspective on this, and your findings were really helpful in the research. I will now hand over to Murali. I see you're ready. Please go ahead.
Hi, thank you, Liz, and good afternoon, good morning, good evening, wherever you are. This is Murali from India, and here we are almost like 60 to 80 million people with a disability in this country. And COVID, definitely when it comes to health, it has affected us very badly and disproportionately, because in the beginning, there was a guideline issued by the Ministry of Social Justice and Empowerment, which takes care of people with a disability, about a sort of relief, which is a small amount, around $15 for 3 months. That was the only provision we could get. But when it comes to health, the regular health services have been completely kept out of reach for people with the disabilities. And when it comes to the COVID-related health services, again, people with the disabilities were considered to be a sort of non-priority. Secondly, even those who could manage, we had a lot of challenging times in terms of accessibility, in terms of attitude of the medical personnel, because when you talk about physical distancing, people with the disability, we could not get the sort of accessible environment to move around. Again, when it comes to quarantine in the government institutions, it was very difficult. We had to survive with another 20 people, regardless of your result, whether you are positive or negative. You have to live with people, and it was very tough for us. After a while, due to the overwhelming cases, the private sector got opened up. Again, the challenge of affordability. Though we could have the access to the health services through the private hospitals, it was the matter of affordability. Again, the people with disabilities who had their pre-existing conditions, we could not have any alternate way to get the services. In fact, a couple of my colleagues or friends who died not because directly of COVID, but the ill effects of COVID due to the lack of access to services. So it is a sort of battle between life and livelihood. We don't know. Today is the 99th day of lockdown, and the rehabilitation services have been completely stopped. The alternate way of accessing the health, for example, the online, is not quite accessible to people with the disabilities. Again, someone has to support us. The physical distancing is preventing that. Interpretation is a difficult one to get, as the distancing challenge is always there. People who want to access hospitals, we are not able to get it because the medicines, the basic assistive devices are not in supply. Everything has been diverted for the COVID related issues. Even the institutions which were supposed to take care of the children with the disabilities and the regular medication, they are literally struggling. And a lot of lapses have taken place because of the sudden stop in the regular medical treatment. So this has been the case. Things hopefully will improve the days to come, we hope, and people can get some sort of reasonable treatment, and the attitude of the health personnel will improve. The DPOs can also raise their voice to participate actively in the service provision, and accessibility will become a reality for us. Thank you.
Thank you so much, Murali. It was very powerful, and I see a lot of similar themes in all three of our presentations. But due to lack of time, I will go ahead and give it back to Elham. Thank you so much, everybody.
Thank you so much. Very good summary of the barriers in accessing healthcare. Thank you to Elizabeth, Murali, and what was it? For your presentations. So now we are going to hear from Rosario Galarza from RAYADES, the Organization of Persons with Disabilities and Their Families from Latin America. She's going to summarize barriers identified in this report in accessing social protection and employment for persons with disabilities, followed by 2 testimonies from the ground. Rosario, floor is yours.
Thank you so much, Elham, and good morning, everyone. And I am going to try to summarize 2 of the chapters of the report about social protection and also employment. For instance, in case of social protection, what the report tries to find is what are the measures put in place by governments and by municipalities in order to protect persons with disabilities. We can find 3 different topics. For instance, we have like a cash benefits. We have also the regular services provided, and we have commodity delivery. And related to cash transfer or cash benefit, we can say that some of the governments provided cash transfer. However, they do not do in terms of equality, because most of these benefits are related to person with disability need to have a bank account, a personal account, and especially persons who live in rural areas, they don't have a bank account. And it means that the governments have to decide in a unilateral way how many persons with disabilities should receive the cash transfer, and the Organization of Persons with Disabilities were not consulted to this regard. Well, in case of commodities delivery, like food or maybe medicines, it was very challenging for persons with disabilities, because in most of the regions, they do not access, especially because they have restriction for movement, and also they have social distancing, and they cannot go and get the food and get the medication. However, in case of, for instance, in Europe, yes, they have positive examples, because they provide food to home for persons with disability and also for older people. And they also provide some unemployment benefit, including independent contractors and parental leave for persons who have maybe a child under 12 years old with a disability. Regarding the employment, we have identified different barriers, for instance, lack of accessibility, lack of connectivity. It's true that many people, especially persons with disability, can work at home, but in most of the region, it was really a problem, because the connectivity was really slow, the bandwidth was not sufficient for that, and they have also very limited access to internet, and also they have facing barriers in the platforms. For instance, lack of accessibility in the platforms, maybe if they are working as telephone operators and other kind of workers. And also in some regions, with the 70% of people are engaged in informal activities, they also were not able to work, and also they did not receive any kind of small grants or subsidy. It's also, I need to also mention that for people, especially blind people and deaf people in Asia who work in the massage industry, due to social distancing, it was very difficult for them. They stopped working, and they also don't know if they are going to work again, because of the new normal are going to be in place now, and they don't know exactly about that. That's why the concerning is that the unemployment definitely is going to increase after the pandemic, and especially for women with disabilities, the ones who live in rural areas, who cannot access also to essential items such diapers or other things. Luckily, there was some support from international NGOs, but now that they are also going to go to the new normal, they don't know also what's going to happen with them. And I would like to invite two persons to give the testimonials. First, I would like to invite Suleiman Abdul Mumuni from Nigeria. Suleiman, the floor is yours.
Hello, everyone. Many of my colleagues have spoken so much on the pandemic. And for the first time, it has changed a lot of things in the world as they go. However, I'm going to give a testimony on two things, employment employment and social protection. On employment, we have two official employment and non-official employment. We can say most of the persons with disability are above the 85% who are not in official or formal sector of employment, because most of them are on their own. They have these micro businesses they are into or into other organizations. However, with this coronavirus and the pandemic, most of them were affected. For example, those that have restaurants that cook food to sell to the people in the community. With the lockdown, they couldn't go out to do their businesses. So how will they survive? And secondly, we have other people who do, who struggle on their own, like join building, they assist the laborers, do minor jobs every day to earn little money. Some clean hotels, clean offices. And during the lockdown, they couldn't go out to do all of that, and they were really good. So there are some families that has corporate business, like tailoring, fashion designing, selling of things in the house. With the lockdown, they need to find a way of feeding the family, which was very, very difficult for persons with disabilities, especially those that farms. For example, the idea, they have poultry, they have animals they care for. Most of the time, they take those goods to the market to sell. But with the lockdown, there's no place they could have taken those things to sell. So when we come to social security, the social security was supposed to be provided by the government side. Right from the beginning, persons with disability were not involved in the planning stage. And so a lot of persons with disability who were supposed to be given priority were affected, they missed out of the list. There's a specific a town the government went to share some palliative, and there was no persons with disability that was involved on the list to be given palliative. And even on the cash transfer, the government promised to give to the people, in the community. We have begun to, to advocate. We began to lobby with the government sector to see how persons with disability or TPOs or friends of TPOs could be involved to bring it down to persons with disability at their local community, or to find a way of transferring the cash to some of our members who are very, very in need of those things, the money. But one of the challenges we faced was that before the lockdown, the government did not give official recognition for almost 1 week. It was just within a day to the day they would do the cash transfer. And so we need to start running to banks to do one or two things. And we have some local community that do not have banks around them. They need to travel down to the city to have access to bank. And if you look at the social barrier, it was supposed to be like intervention on labor market, which the government failed to do. And also it was supposed to be social investment. social insurance. Because we have some people that have individual businesses. If anything happened to their business, or maybe the shop he or she is using got burnt, they were supposed to be given some insurance, but there was nothing like that. And also there are situations where emergency will occur. Where will this person with disability run to? With the lockdown. And we know that there is movement. And a lot of persons with disability live in villages, in local community. They were all helped by their family members. So the most important thing is that with this pandemic, we have learned a lot of lessons from it. And we are supposed to have the proper data of persons with disability. That is number one. Number two, there is a need for institutional platform where
Sorry,
quality can be processed.
I have to ask you to wrap up because we are running short of time, and we have one more.
Okay, just to wrap up. Okay. So, if an institutional platform where persons with disability, go to lay contain and do all of other things, and then Nigeria borrow money from government side. With this institutional platform, they can go there to, apply for loans. And also government can also give full attention to persons with disability through their individual organization, so that any concern that has to do with persons with disability, all these individual organizations of persons with disability can easily interfere, because they all know how persons with disability are being affected. Thank you so much.
Thank you so much, Solima. Yes, I mean, the report also shows that most persons with disability who have run micro and small businesses, they lost their income and now they are thinking about how to start again. Well, I'm going to invite Olga Alman in order to share her testimony. Olga is from Dominican Republic.
Good morning.
Olga, the floor is yours.
Good morning. Thanks for inviting me to talk about employment and share my work experience following the COVID-19 pandemic in the Dominican Republic. My name is Olga Altman. For a year, I have been part of the talent program for young professionals with disabilities created by the United Nations Development Program, UNDP, and the United Nations Volunteer Program, UNV. We work in the development of initiatives and projects on the inclusion of persons with disabilities in the Dominican Republic. Here, according to the 2010 census, the population with a disability in the country amounts to around 1.2 billion people, which represents 12.3% of the national population. 61.1% of the population with disabilities is economically inactive, don't have an occupation for both men and women, 46.9% in men and 71.8% in women. According to the survey we carried out in April from the UNDP together with the National Council on Disability on the COVID-19 situation and persons with disabilities, to which 421 people responded, 45.8% of persons with disabilities are economically active who have an occupation, but 28% have had a reduction in salary. Also, 28% of persons with disabilities temporarily lost their job, and 23.6% of persons with disabilities permanently lost their job in the last 2 weeks due to the situation. Before confinement, I went to the office on a regular schedule, and due to my physical disability, I had, within reasonable accommodation, a person who provided me with personal assistance and transportation. For approximately 3 months, all of the staff from the office have been working remotely. Reasonable accommodation have been put in place for me to work from home. My employers adapted my computer, provided me with a webcam, and I have internet access. Due to the risk of contagion, my personal assistant could not continue working, but she has been compensated for her work she did, and my mother has been helping me. My experience with teleworking is not new since I have worked this way before, and this has allowed to me continue working, although I feel that my stress levels have increased since we have a bigger workload because we are developing many actions to quickly respond to the needs of persons with disabilities. I am concerned about going to the office in person. I thank my office and team to taking into account all the containment measures and ensuring that the staff continue to work. With this, I conclude my presentation. Thank you very much.
Thank you so much, Olga. This is a concrete example that remote working opportunities are possible, but sometimes the employers put more barriers about accessibility because they don't want to try to adapt the jobs. Thank you so much, and thanks everybody to listen about social protection and employment findings in this report.
Thank you so much, Rosario, and also thank you so much to Suleiman and Olga for wonderful testimonials. Unfortunately, we are running out of time, so we won't have time for questions and answers. We received some good questions, but we are not going to have time to answer to them. But there's a good news here, which is that we are going to have a side event for high-level political forum on sustainable development, HLPF, on July 8th, which is next Wednesday. And my colleague is going to paste the information to register for that call here. So I invite all of you to join that call, that side event, and hopefully hear more about how to achieve sustainable development for persons with disabilities during the pandemic. I want to wrap up here by expressing our deepest thanks to colleagues from the stakeholders group of persons with disabilities for this wonderful report. This is actually a very strong tool that we all can use in our advocacy work. So I encourage all of you who are engaging in advocacy work to use this report in your work, and please keep us posted in case you use it. In case you use part of it for your work and you see some results, please let us know. And we will be happy to work on, I think there is a good news that also their stakeholders group is working on another version of this report for future. So you will hear more about it in the future. Thank you so much, all of you, for joining. And also thank you to interpreters, captioners, people who joined us, some of them early in the morning, some of them late in the afternoon, and all of you for your patience, contributions, and look forward to hearing from all of you soon again. Have a great day. Bye.
Thank you.